By the time you turn 60, your heart has already beaten billions of times, working tirelessly to keep you alive. It has carried you through joys and struggles, but with age, it also becomes more vulnerable. In the United States, heart disease remains the #1 cause of death among older adults, and what's truly heartbreaking is that so many hospital emergencies come from signals that were already there, just ignored. I want you to pause and ask yourself, have you ever felt an unusual fatigue, shortness of breath after just a few steps, or a dull ache in your chest and told yourself, it's just aging? The truth is, the heart never lies. It whispers its warnings in subtle ways. The real question is whether we're listening. In today's video, I'll walk you through 10 warning signs of heart trouble that seniors often overlook. Recognizing them early can save your life or the life of someone you love. Because health is not just about numbers on a chart. It's about continuing to live fully, sharing moments with your family, and protecting the gift of time. One of the first things I often hear from patients is a heavy or tight feeling in the chest. Many dismiss it as indigestion or muscle pain. In reality, this is one of the most common signs of coronary artery disease. When the arteries that supply blood to the heart become narrowed, oxygen can't reach the heart muscle adequately. A patient once told me, "Doctor, every time I push a heavy cart at the market, I feel a sharp pressure in my chest, but it goes away when I rest." So I ignored it. That very act of ignoring led to a full-blown heart attack. Left untreated, chest pressure can result in a fatal heart event. But caught early, with lifestyle changes, medications, or timely intervention, the heart can recover and remain strong. Another sign that many people brush aside is shortness of breath with only mild activity, like walking a short distance or climbing a few steps. Seniors often think, "I'm just slowing down." But in truth, breathlessness may signal heart failure or valve disease. I remember a patient asking, "Doctor, even carrying a light grocery bag leaves me gasping. Is that normal?" And I replied, "No, it's a warning. Your heart may not be pumping efficiently." Left unchecked, fluid builds up in the lungs, leading to swelling and exhaustion. But when addressed early, medical treatment can restore heart function and bring back ease of breathing. There are also patients who tell me, "Doctor, I feel drained, even without doing anything strenuous." Persistent fatigue is often blamed on aging or poor sleep, but in people over 60, it can mean the heart isn't pumping enough blood to supply oxygen to the body. The brain, muscles, and vital organs all struggle when starved of oxygen, leaving you weak and weary. Ignoring this leads to a vicious cycle. The weaker you feel, the less you move, and the weaker your heart becomes. The good news is that with early recognition, proper diet, gentle exercise, and the right medications, energy can return. When the heart gets stronger, life feels lighter again. Then there are times you might notice swelling in your ankles or feet, especially by evening. Many attribute it to walking too much or just water retention. But swelling in the legs is a classic warning of heart failure. When the heart can't circulate blood effectively and fluid leaks into the tissues. A gentleman once asked me, "Doctor, is this because I eat too much salt?" Salt can worsen swelling, but the root problem was his heart. If untreated, swelling worsens and leads to advanced heart failure. But with timely care, reducing salt, taking diuretics, and treating the heart itself, patients often find relief and walk comfortably again. At other times, you may notice your heart racing or skipping beats, sudden pounding, fluttering, or a strange pause in rhythm. This is a sign of arrhythmia. At 60 and beyond, many dismiss it as stress or too much coffee. I recall one lady who told me, I was just watching TV when suddenly my chest pounded wildly and I felt dizzy. That was atrial fibrillation, a rhythm problem that can cause blood clots and strokes. The good news is that with a simple ECG, doctors can diagnose it early. Blood thinners, medications, or even a pacemaker can protect patients from dangerous complications. Chest pain is not always in the chest. In older adults, heart trouble can appear as pain in the left shoulder, arm, neck, or even the jaw. This is why so many confuse it with arthritis or muscle strain. I once had a patient who went to see a dentist because of jaw pain, only to discover he was experiencing reduced blood flow to the heart. If ignored, this can escalate to a heart attack. But with early testing and intervention, the risk of severe damage can be avoided. Sometimes the warning comes in the form of dizziness or fainting. Many assume it's just low blood pressure or standing up too quickly. But in seniors, it can mean the heart isn't pumping enough blood to the brain. A patient once shared, "I was walking in the park when everything went dark, and thank God someone caught me." That fainting spell was a sign of arrhythmia or valve disease. Overlooked, the next episode could result in a dangerous fall or sudden death. Early evaluation and treatment can prevent such outcomes. Another sign few connect to the heart is a lingering cough or wheezing, especially when lying down. When the heart weakens, fluid builds in the lungs, leading to a chronic dry cough. A woman once told me, "Doctor, I thought I had asthma, but it was actually my heart." This confusion is common. Left untreated, heart failure progresses and damages the lungs further. But with proper diagnosis and treatment, the cough eases, breathing improves, and restful sleep returns. Sometimes the signal is cold, clammy, sweating without any clear reason. You're sitting quietly, yet beads of sweat form, and a wave of anxiety hits. This can be the body's way of alerting you to an impending heart attack. One man recalled, "I thought it was just the heat, but my body went cold. I was trembling, and minutes later, the crushing chest pain came. Thankfully, he got to the hospital in time." Never ignore cold sweats. They're an urgent warning to seek help immediately. And finally, if there is one sign I urge you never to dismiss, it is a decline in sexual desire or erectile problems in men. The blood vessels in the sexual organs are small and delicate, so blockages there often appear before blockages in the heart. Many are too embarrassed to bring it up, thinking, "That's just old age." But in truth, it can be one of the earliest signs of cardiovascular disease. When treated, patients not only improve intimacy but also protect their heart from more serious events. We've just walked through signals that may seem small but carry enormous weight for your health. Each one is like a bell ringing softly, warning that your heart needs attention. And that final sign, though rarely spoken of, reminds us how deeply the heart is connected to every part of the body. The earlier we notice, the earlier we act, the more we protect not just years of life, but the quality of those years. Listening to these whispers is the key to living safer and stronger. Friends, your heart never stops sending messages. The question is, are you willing to listen? From unusual fatigue, shortness of breath, to persistent coughs, or unexpected cold sweats, all of these can be early warnings. What I want you to remember is this: never brush off changes in your body. Don't simply tell yourself, "It's just age." Seeking care early and speaking honestly with your doctor can make all the difference in preserving heart health and extending your life. If this video has been helpful, please click like, share it with someone you care about, and leave a comment below about your own experiences. Your awareness today could save a life tomorrow. And don't forget to subscribe to our channel, where we share practical, science-based health tips to help you live longer, healthier, and happier after 60.